Hi folks, Dr. Rob Barrington here with some more nutrition advice. Now this video is going to be about antioxidants, and it's going to be a little bit different. I wanted to talk about antioxidants and how they can actually be beneficial before they've been absorbed to the tissues of the body. Now the reason I'm making this video is because I got a comment from one of my subscribers and they had made the comment on a video that I'd made on vitamin C, that not all of the vitamin C is absorbed in humans and animals as well. And I agreed with their comment, and it was quite true. When you take tablets of vitamin C, or you take vitamin C in food, not all of that vitamin C is ultimately absorbed and ends up in the tissues. A lot of it remains in the gut where it's processed, and other metabolic routes occur, and some of it is ultimately lost. So what I wanted to do is actually create a video and actually show that with antioxidants you don't actually need to get them absorbed much of the time in order for them to have a beneficial health effect. Now this sounds a little bit counterintuitive. When we look at minerals and vitamins, really they need to be absorbed in order to be able to have beneficial effects in our tissues. And it's often assumed that the same is true for antioxidants, but it's not necessarily the case. And there's an increasing amount of evidence that shows that antioxidants are actually have health effects inside the gut, and that might be actually some of the ways that they actually are beneficial to our health. So I want to concentrate on two ways that antioxidants can improve our health without even them being absorbed from our gut. And the first one it relates to cardiovascular disease. And the second one relates to reducing the risk of cancer. So if we look at one of the ways that antioxidants can actually protect us in the gut, our gut is really a bioreactor. We have a stomach, obviously, which contains hydrochloric acid. That acid environment is, the temperature of that acid is kept at body temperature, 37 degrees. Then we have a small intestine, which neutralizes the acid and produces an alkaline environment. And there are many enzymes, there are many chemicals, and these chemicals and enzymes all mix together, and they form a lot of different chemical reactions, many of which aren't fully understood. Now, one of the things that we ingest with our food are fats, and those fats go into this bioreactor. And one of the byproducts of putting those fats in this kind of warm, enzyme filled soup of acid and then alkali is that some of the fats get oxidized, and those oxidized fats form lipid peroxides. And it's well known and it's well reported that even high quality foods, if you eat high quality foods, the fats within those foods undergo oxidation, they become lipid peroxides, they're absorbed, and then those fats, once they're in our circulatory system, are incorporated into our cell membranes, because our cell membranes are very fatty. The cell membranes are composed largely of fats. And those fats, when they're oxidized, they increase the risk of free radical formation. And once the free radical formation starts, there's a chain reaction, and that leads to oxidative stress. And the more of these lipid peroxides that you consume, the more that are produced in your stomach and the more you absorb, the higher rates of oxidation you have in your tissues. Now, there have been a number of studies that have looked at the ways to prevent these lipid peroxides from being formed. Obviously, one of the ways would be to consume less fat, because if you consume less fat, there's less chance of you being able to form these lipid peroxides. Much fewer of them will be formed, and then obviously fewer of them will be absorbed. But another way to reduce production of these lipid peroxides is actually to consume your food with high amounts of antioxidants. And it doesn't matter that those antioxidants aren't absorbed, because those antioxidants are having an effect in your gut. And one study, for example, that comes to mind that I've used quite a lot, and I've referenced it quite a lot in some of my articles, is a study that looked at the effects of red wine on lipid peroxidation in fats in animal guts. And what it found was that when the red wine was eaten at the same time as I think they actually used turkey, when there was a turkey meal fed to the rats, when the red wine was actually given with the turkey, the amount of lipid peroxides formed from the turkey fell about threefold. So that red wine is having a health effect without being absorbed. The antioxidants in that red wine are decreasing the lipid peroxidation in the turkey, and those lipid peroxides ultimately would damage your health. And so by preventing the formation in the gut, that red wine, even before it's being absorbed, if it's absorbed, is actually having a health effect. So going back to the vitamin C, you know, there are many antioxidants in our foods, and red wine, you know, a limited amount have been researched in terms of their ability to have antioxidant effects in the gut. But we do know that many of the antioxidants in plant foods, for example, are really poorly absorbed. My PhD was in looking at investigating the absorption of flavonoids, and the absorption of flavonoids is not it's not fully understood, but it does appear that they're not actually that well absorbed in the small intestine. There's a large amount of metabolism of the flavonoids that we have in our food, and many of them are effluxed back into the gut after they've been absorbed to the enterocytes. They're metabolized, they go through phase 2 conjugation, and then they're passed back into the gut, and ultimately they end up in the colon, where they're metabolized by gut bacteria. So the original parent compounds from many plant foods don't actually get into the body. What actually gets into the body is a metabolite, you know, usually a phenolic acid, a breakdown product of the flavonoid. Now that still has antioxidant properties, and it's known that the breakdown products from flavonoids, these phenolic acids, do have antioxidant potential in the body, but it's not the original flavonoid. It's not the original antioxidant that you're consuming that's actually having an effect. It's a downstream metabolite. And I would suggest that many antioxidants that you consume with your foods, particularly those in fruits and vegetables, are having this beneficial effect actually in your gut before they're absorbed. There is evidence that these, you know, if you have a plant-rich food diet and you consume antioxidants, there is evidence that your antioxidant status improves and your oxidative stress levels go down. But it's not exactly clear whether that effect is in the tissues, or is it a knock-on effect from the fact that you're absorbing less of these lipid peroxides that are actually one of the causes of oxidative stress. So this is it's actually a grey area, and it's actually very interesting when you start looking into this, because what you believe to have been happening may not actually be what's happening, and another picture emerges. So this, you know, understanding that these antioxidants could be actually having their effect in the gut, in this kind of bioreactor that we have, this acid environment in the stomach, it produces lots of chemicals, and some of those chemicals react with fats, they oxidize the fats. If you limit that oxidation, you stop the absorption of those lipid peroxides, you have a downstream effect on oxidation, you prevent oxidation in the tissues. So it could be that the decrease in oxidative stress you see with the consumption of many of these antioxidants in plant foods is actually a downstream effect of what's happening in the gut. Obviously, these lipid peroxides, how do they relate to cardiovascular disease? Well, oxidative stress in your tissues is one of the it leads to inflammation, and inflammation is one of the causative factors in insulin resistance, and once insulin resistance develops, you start to develop the metabolic syndrome, and the metabolic syndrome is really a precursor to all of the circulatory detrimental circulatory effects that you see with cardiovascular disease. So it's really you know, you start with oxidative stress and you end with cardiovascular disease, and there's some inflammation in the middle, and that's really how cardiovascular disease you know, develops. I think it's very highly related to the foods that you eat. There is a genetic component, but really, when you start to look into studies of cardiovascular disease and you trace it back, it's this oxidative stress and this inflammatory process, and that process occurring in your blood vessels is what really leads to cardiovascular disease. And this is under the kind of the background development of insulin resistance, and this is a kind of this metabolic syndrome cardiovascular disease cluster of disorders. The symptoms tend to be slightly different in different people, but they tend to cause the same types of problems. And really, ultimately, if you trace those problems back, they stem from poor diet, from poor lifestyle habits. All of those things cause the cause of the cardiovascular disease is really this increase in oxidative stress. So if you can decrease the absorption of those lipid peroxides, you can decrease oxidative stress, and that's going to be cardioprotective ultimately. I'm not going to say that that would stop you getting cardiovascular disease, because obviously it's a multifactorial disease, there are other causes, but certainly it's going to decrease your risk, and those antioxidants don't have to be absorbed to have that effect. If we look at cancer, cancer is another interesting disease that can actually occur in your gastrointestinal tract. And one particular very good example that comes to mind is the formation of nitrosamines in processed meat. Now, processed meat tends to be stored for a long period of time, and so it needs to be preserved. And one of the main preservation agents that they use in processed meat is sodium nitrate or sodium nitrite. They use these chemicals because they inhibit the growth of bacteria. They're toxic to the bacteria, and therefore you can add sodium nitrite or sodium nitrate to meat, and it inhibits the growth of bacteria, and therefore you can keep that processed meat and you can store it for long periods of time. Now that's obviously very good because we don't want to be eating toxic bacteria with meat that's been on the shelf for 2 years. However, those nitrite and nitrate compounds, they while they're in the meat, they actually start to form nitrosamines, and those nitrosamines have been shown to be able to initiate gut cancer. Now that's not the only bad news, because once you consume the processed meat, the sodium nitrate and the sodium nitrite can also catalyze the formation of nitrosamines in your stomach. Your stomach is a with the acid and the warmth and all of the chemicals that are there. Your stomach is really an oxidizing area. It oxidizes chemicals, and this is why you get the formation of lipid peroxides when there's fat there. And this oxidation process in the presence of nitrite and nitrate can lead to more formation of nitrosamines in your stomach. So the nitrosamines that are already in the food, they increase when you eat this processed meat, and you end up with lots of nitrosamines in your stomach because it's an oxidizing environment. And these nitrosamines have been shown to be carcinogenic. They increase the risk of certain gut cancers, and they seem to be able to initiate the formation of cancers, probably from causing DNA damage in the cells of your gut. Now, the good news is that you can inhibit the formation of those nitrosamines by taking antioxidants with the processed meat. And there's been a reasonable amount of studies that have looked particularly at vitamin C and its ability to inhibit the formation of nitrosamines. And vitamin C does appear to have this ability to inhibit nitrosamine formation because it's a reducing agent. And obviously, if you add a reducing agent to an oxidizing environment, you inhibit the formation, you inhibit the ability of that environment to oxidize chemicals. In other words, vitamin C is having an antioxidant effect. It's reducing chemical reactions, and that inhibits some of the nitrosamine formation, which limits the amount of nitrosamine that you will absorb. That's not to say that you can just take vitamin C with processed meat and it will have no effect, because there are already nitrosamines formed in the meat when it's been on the shelf, but it will certainly limit the formation of further nitrosamines, and therefore have a protective effect. And there have been a number of studies that looked at vitamin C, flavonoids, other antioxidants, and particularly the flavonoids that are in green tea. Now, the flavonoids that are in green tea, when you look at their protective effects, their most protective effect appears to be, and this is a consistent finding, on esophageal and other gut cancers. And that would make sense because they're acting in the gut. You drink green tea regularly throughout the day. It has a reducing effect because the flavonoids in green tea are reducing agents, they're antioxidants. And this could be one of the ways that green tea is actually protective of cancer. Consistently, of the cancers that we develop, green tea is protective of gut cancers. And I don't think that's an accident that the green tea is in contact with your gut cells when you're drinking it. And I think it's having an effect inside the gut. And therefore, is it really necessary for those flavonoids to be absorbed to have a beneficial effect on health? Possibly not. I'm sure some of them are absorbed. There is good evidence that there is an increase in there is an increase in the catechins and catechin derivatives after you've consumed green tea in our blood. But it appears that the fact that they're protective, particularly protective and highly protective of gut cancers, would indicate that the green tea is actually having an effect in your gut before it's absorbed. And I would suggest that the same is true for vitamin C as well. Yes, vitamin C is absorbed into our blood. We know that. We can measure it after we've taken vitamin C tablets. But there is good evidence that vitamin C is part of this protective effect that we have in our guts that protects us from producing these nitrosamines that ultimately could cause gut cancers. So I hope you found that interesting. I just wanted to kind of explain why antioxidants really sometimes don't have to be absorbed. So if if you look at a paper and you see a paper and it shows that the absorption of a particular antioxidant is very low, don't dismiss it that that doesn't mean it can't have health effects. Many of the flavonoids, many of the polyphenols that we find in plants, many of the supplements we take, they aren't well absorbed, but that doesn't mean that they can't have beneficial effects on health. So as always, eat well, stay healthy, and protect yourself, and I will see you soon for another video. Take care.